Things I see as a podiatrist
So
assistant.
right now we're going to treat a patient who has multiple calluses, a few corns, and also some fissures. If you can see these deep cuts that are underneath the plantar surface of the foot, you can also see some on the heel. Well, this causes excruciating pain when walking because these areas often get pretty dry, and as you can see, the skin levels are not, the skin layers are not leveled. So there's this deep cut, which is called fissures, in between the skin. So every time we put our foot down and weight bear, this just starts to open even further, causing more pain. So we have a mixture of callus. This is also fungus at leaf feet, which we're gonna give an antifungal medication to treat. And right now I'm going to debride all of this, try to get the skin on an even layer so that we can have proper skin renewal. And then we're going to go ahead, along with a bunch of prescriptions as well, topical, along with our shea butter, which is really going to help to remove this thick layer of skin and renew that fresh layer of skin. And also the oral medications to treat the fungus. This typically happened because the patient said that they were going to get pedicures at the nail salon to help give some relief for the thick, dry skin. And essentially, it just made it worse. So I tell patients I just really don't recommend getting pedicures and getting your feet scraped with the cheese grater. Otherwise, you're going to end up in this position because it actually does the opposite as far as helping your foot. It just causes that skin to renew with thick, this type of yellow, really tight, thick, leathery skin. And that's not the skin that we want. We want really soft skin like a baby's bottom. So now we're just gonna treat it and get this skin to renew so that we can get it back to good, healthy skin. And already we've filed some of it down. So it's much better than it was when the patient first came in. And just continue to watch and we'll see the results that we get. And this part of the debridement and everything is very important because otherwise the topical medications and everything really won't work. We need it to be able to penetrate through a thin layer of skin, and this skin is so thick right now that anything that we would have used would have been really hard to get through and penetrate to be really effective.